One of the most common orthopedic problems that we see in our office is tendonitis. Tendons are thick cords of tissue that connect muscles to bone. When tendons get inflamed and painful due to overactivity or an injury, the condition is called tendonitis. There are a few tendons in the foot and ankle that are prone to getting inflamed, and they include the Achilles tendon, which is located behind the ankle and the heel bone, the posterior tibial tendon, which is located in arch in the inner side of the midfoot, the extensor tendons, which are located on the top of the foot and the ankle, and the peroneal tendons, which are located on the outer side of the ankle and the rear foot. If the pain doesn't go away with rest, ice, and over-the-counter medication, or if the pain persists beyond a week, it's time to see us. In addition to a physical exam, other diagnostic exams such as X-rays, sonogram, and MRI may be needed to rule out bone fracture or a tendon tear. The treatment of tendonitis is centered around reducing inflammation and stabilizing the foot structure to prevent further strain on the tendon. Rest, ice, anti-inflammatory medications, strapping of the tendon along with laser for pain is our initial treatment. In certain types of tendonitis, a short-acting cortisone injection can be given around the tendon to decrease inflammation. If these measures are not successful, then immobilizing the foot and the ankle with the use of a walking boot for up to 4 to 6 weeks can help resolve the problems. Once the inflammation resolves, physical therapy can be initiated to strengthen muscles of the foot and the ankle. One of the best ways to prevent the tendonitis from coming back is to use a pair of custom foot orthotics. Our office is equipped with state-of-the-art technology to make the most comfortable custom foot orthotics with the use of 3D scanner. These custom devices not only improve the foot and ankle motion, but also minimize the abnormal pressures on the tendon of the foot and the ankle. So don't let that tendonitis pain become a chronic problem. Just come in and get treated.